Friends, today we'll discuss about 10 steps of doing ultrasound which you have to follow during ultrasound examination. 10 steps of doing ultrasounds are: first step, choose right or correct transducer. Second, know your screen orientations. Third step, adjust frequency knob. Fourth step, adjust depth knob. Fifth step, swipe the probe to take multiple slices of a organ. Sixth step, adjust overall gain knob or gain knob and TGC knob. Seventh step, adjust focal zone knob. Eighth step, adjust color Doppler knob. Ninth step, adjust power knob or pulse wave knob. 10th step, at last adjust zoom knob. Remember, first take a good grayscale image, then put color in it, then put power knob on it, then use zoom on it. Zoom is the last option. If you use zoom at the first, the clarity of the image will decrease. So zoom is the last option. First take a good grayscale image, then put color on it. At last you zoom on it. First you choose a right or correct transducer. If you are going to examine an abdomen, you should use a curvilinear transducer. If you are going to examine a peripheral structures like thyroid, breast, and scrotum or peripheral arterial system or peripheral venous system, you should use a linear transducer. If you are going to examine rectum or vagina, you should use a transvaginal or transrectal transducer. Know your screen orientation. If you are going to take a transverse section of an organ, the probe marker should be towards the right side. If you are going to take a longitudinal section of an organ, the probe marker should be towards the patient head. Then adjust frequency knob. Frequency knob is the first knob. While you are going to examine an abdomen, you should use curvilinear transducer. The frequency range should be in between 2 to 5 MHz. That is, frequency range is toward the lesser side. If you are going to examine a peripheral structure, you should use linear transducer. The frequency range is towards the higher side. That is in between 6 to 15 MHz. Remember, while taking peripheral examination, the frequency range is towards the higher side. While you are taking abdominal examination, the frequency range is towards the lower side. Then adjust depth knob. Remember, keep your depth up to the area of interest. Keep your depth as low as possible. Keep the depth up to your area of interest. Keep your depth as minimum as possible. By decreasing the depth, the resolution will be increased, which increases the frame rate, which increases the quality of image. That is, by decreasing the depth, the quality of image will be increased. Then swipe the probe to take multiple slices of your organ. Never keep the probe static. Always fan your probe. Never keep the probe static. First angling, then slide the probe on broad axis. First dipping, then slide the probe on narrow axis. Remember, do not keep your probe static. Always fan your probe little bit. Then adjust gain knob or overall gain knob and TGC knob. Remember, always keep the image towards darker side. Never keep the image towards brighter side. By keeping the image towards darker side, the quality of the image will increase. Remember, keep the image towards darker side. Then adjust focal zone knob. Remember, Always keep the focal zone as minimum as possible. By keeping multiple focal zone, the quality of image will decrease resolution of a image. Always keep the focal zone as minimum as possible. Then adjust color knob. First take a good grayscale image, then put color box on it. The color box should be vertical and as small as possible. If the color box is vertical and as small as possible, good quality of image will be produced. Two color will be appear in the color box. Red color for direction of the blood flow toward the probe. Blue color for direction of the blood flow away from the probe. Remember BART. Then adjust power knob to know the systolic and diastolic velocity. Remember, first take a good grayscale image, then put color box in it, then use power knob on it. At last, use zoom knob. Zoom is the last option. First take a good grayscale image, then put color on it, then use power knob on it, then zoom on it. Zoom is the last option. Why using zoom knob as the first, the clarity of the image will be decreased. So use the zoom knob at the last. Thank you. Thanks for watching.